My main area of expertise is the early detection of cancer and risk prediction modelling related to pancreatic cancer, as well as the early detection of cancer in Mongolia. So in 2019 we were invited over to the National Cancer Centre in Mongolia to develop research ideas and collaborative research related to the early detection of cancer. We then successfully obtained NIHR funding to explore the health policy literature related to early detection of cancer in Mongolia and to identify gaps through interviews with policymakers that were related to the early detection of cancer, and this highlighted that cervical screening was suffering delays in return of results due to a lack of trained cytologists in rural Mongolia, and then that led us to design the project to explore options for primary HPV screening. So the key collaborators are Dr. Bayasakan at the National Cancer Centre in Mongolia and Dr. Urambalar, and they work within the National Cancer Centre focused on the early detection of cervical cancer. We also receive funding from the NIHR and DFE GCRF, and the project involves key interviews with stakeholders, including people within the Ministry of Health, within the cancer departments there in Mongolia, and will involve key informant interviews with a range of people involved in cervical screening. So this will mainly take place in Mongolia itself and with the National Cancer Centre, and will be a year-long project to just explore the acceptability to women in Mongolia and the feasibility of sample transport between one area of rural Mongolia and the National Cancer Centre where the analyses will take place. So the research involves a review of the literature related to cervical cancer in Mongolia, key interviews with stakeholders and people involved in cervical screening in Mongolia to assess the acceptability to them of introducing a new modality and make sure that it's acceptable to the culture over there in certain areas of rural Mongolia. And then it involves feasibility of the actual process itself. So cervical samples will be taken from people that consent to take part in the study. They'll then be shipped to the National Cancer Centre in Mongolia for analysis for HPV tissue and for cytological abnormalities, and then they will be followed up if there are any abnormalities identified, and then that will identify whether that process is faster than the current method being used. In terms of the long-term outcomes, we're hoping that this will lead to bigger projects to make sure that this whole process is much more effective and speedier than the current screening modality in Mongolia, and hopefully lead to the adaptation of HPV screening in rural areas so that that can improve the early diagnosis. So the future change, we hope to adapt this strategy so that it's culturally acceptable and feasible to women living in rural Mongolia, and hopefully ensure that cervical screening is optimal and as effective as possible and speedier so that the uptake increases. And if that's successful, then we could lead to an improvement in the early detection of cervical cancer in Mongolia, as early detection is vital for improving treatment and making sure that people with lesions are picked up as early as possible, and then they can go about living their lives.